welcome back to another fun-filled, exciting, educational, and empowering episode of Mind, Your Body, and Soul, the healthiest podcast you have ever heard your entire life. I am Joseph Ward. I am solo today, but it's all good. Make sure you all check out last week's episode when our Ryan White team got together, myself, Mathias Sweet, Miss Carrie Brown, and Miss Atlanta Steeple. We got together and we talked about what is multiple sclerosis and a very, very lively and educational conversation about MS. So make sure you check it out right here on this Neighborhood Medical Center YouTube channel. And remember, once again, this is Mind, Your Body, and Soul. And Mind, Your Body, and Soul is an educational podcast that focuses on all things health related, to help our listeners learn more about various health topics and information they may not have access to. We seek to inform, empower, uplift, and mobilize our listeners to become the healthiest versions of themselves. And we're available on our website at www.nmcpodcast.com, as well as our parent website at neighborhoodmedicalcenter.org. We're also available on podcast platforms such as Anchor, Breaker, Radio Public, Pocket Cast, Spotify, Google Podcasts, and of course, we're available right here on YouTube. So subscribe to this channel, like this video, share this video, and leave a comment in the comment section, because this is going to be some information that you want to know. And remember, that helps the algorithm. More people can see this information. More people can have access to this information if you're sharing, commenting, liking, and all those other things. So make sure you do that. All right. So we're welcoming back our friend, Ms. Danyelle Williams. And last you saw her, she was a part of our panel discussion for National Women and Girls HIV/AIDS Awareness Day, and thank you for being a part of our panel. It's definitely a pleasure having you on that. So, Miss Williams, or Dr. Williams, reached out to me a while ago, and she has a research project that she's doing, perceptions of sexual behavior within the MSM population during COVID. So she reached out to myself and our Ryan White team because we do work with MSM populations here in the Big Bend area, and we are associated with other members of the MSM community. So we said, not only will we help you be able to get connected with the community, but we want to help you get the word out, but we want to know more about your research and just the who, what, where, when, why, and how behind this. And hopefully, we can help you get the study done and be able to get some information and be able to use it to see what was really happening during COVID. And HIV numbers, last I saw, we had about 40 cases in this area in 2021. And, that's that's good, but it's low, because we also know that there are a lot of people who were not being tested during COVID. And so Dr. Williams' study is going to help us learn more about the intimate details of what went on behind the scenes in the sexual lives of men who are MSM during COVID. So welcome back, Dr. Williams. Welcome back. Thank you for joining us on this blessed Tuesday.
Thank you again for having me. I greatly appreciate your help and excited about this conversation we're getting ready to have today. So appreciate your time.
Oh, no problem. And we appreciate being able to talk to you, learn more, but also want to be a part of helping you be successful in this. But before we get started, what overall prompted you to choose this particular study?
So, as you talked about during COVID-19, there was a lot of things that were going on, right? We saw back in 2020, when COVID first began to spread rapidly throughout the country, we saw widespread panic. We also saw state governments begin to enforce these quarantine or stay-at-home orders. Mm-hmm. And so at that time, we didn't know much about the virus and how it was transmitted. But as soon as we began to learn more and more about its transmission, the recommendations from the CDC were to basically limit as much contact with people as possible. We learned that the virus was being spread through respiratory droplets from an infected person through the air. So if a person with COVID would cough and someone were to breathe it in, you could be exposed that way. You also could be exposed from touching any type of contaminated surfaces that had the virus, and then touching either your eyes, nose, or even your mouth was also a way that you could come in contact. And so basically, we started to see similarities with COVID and transmission as we did with HIV and STD. So when a person is exposed to an infected person, that places you at, of course, greater risk for the virus. And so when it came to those stay-at-home orders that forced us to stay inside and limit this contact, you would think that everyone would be following that, right? That's kind of like our idea of stay-at-home orders means you stay home, you don't go anywhere. But we also know that sometimes people were not following those orders. And so I wanted to look at that and see if being forced to stay in quarantine would have any type of impact on sexual behaviors, whether that meant increasing the frequency or decreasing the frequency of those sexual behaviors and activity, or if it had an impact on how they were engaging in sexual activity. So that's kind of where the basis of my project came from, is to really look at how did that quarantine time, those few months that we were forced to stay at home within the Big Bend area, how did that have an impact on the MSM population and their behaviors?
Yeah, that's very interesting. And now I want to know. Just the curiosity in me, because you made me think about something. I remember several people asking me, especially in 2020, that they literally asked, "Do you have a COVID buddy?" And I be under a rock a lot, so I know where my mind went. So I'm like, we're supposed to do that, because it's like shelter in place, stay away from people, because we have this virus that could spread. So in my mind, it's like stay away from people. But no, we had a lot of people who in their mind was, I'm going to hook up with somebody. So we do know sexual activity definitely increased on COVID. So, but I would be interested in seeing overall numbers, just in general population of how much the sexual activity increased, but also within the MSM community.
Mm-hmm, exactly.
So, okay. And so, but overall, just looking at everything that sparked your interest in the study. So conducting this study, you're learning about perceptions of MSM sexual behavior. Is this your study? You got the study from somebody else? You saw this somewhere? Like who's the brainchild behind this study, and how did you become acquainted with the study, or is this something you created from the beginning?
Yeah, so as a grad student at Florida A&M University, graduate next month. So shout out to the class of spring.
Congratulations.
Thank you. But we are required to complete a graduate project. And so I knew that I wanted my project to focus on HIV, since, that's my background. And so I definitely wanted to learn more. And as a Master of Public Health student, we are allowed to pick concentrations. And so my concentration is in behavioral science and health education, which basically looks at how human behaviors affect our overall health. And so we get a lot of foundational knowledge in developing programs that are aimed at health promotion, to promote and educate, as well as provide education on disease prevention. And so with my concentration, we learned that you can actually study and predict human behaviors based on health theories. And so my research project is actually focused on one of the more common health theories, which is called the health belief model. So health belief model, in its essence, basically says that people are more likely to change their behavior based on their perception. So that perception is going to be looking at, do you feel that you are at risk of developing disease? Is the disease serious enough for you to think about taking action? It also looks at their perceptions of benefits, or maybe any barriers to taking action. And so it's different components that make up this health belief model. But for my study, I'm only focusing on just 3 out of all of them. And so I'm going to be looking at the perceived benefits, the perceived barriers, as well as risk of sexual behaviors in MSM during that COVID-19 time.
Right. Okay. So I speaking of that, because you're talking about risk and things, just based off the knowledge and experience that you have in HIV, the time that you worked as a pharmacist, even time that you worked as a counselor and tester, what do you believe? What are some of the, I guess, some of the biggest factors or some of the things that you think you may find as far as sexual behavior based off of what you already know about this population?
So, well, to be honest, that's why I chose this population specifically for this study, because it was one that I'm not too familiar with.
Okay.
And so I wanted to make sure that if I'm going to call myself a public health professional, if I'm going to be a health educator, I need to be able to understand about all populations that we serve. I mean, obviously, I'm a Black woman, so, you know, I can relate to that group, but I'm not in the MSM population. So I definitely wanted to take an opportunity while I'm in school, while I have the resources that I do, to educate myself, right? So I'm hoping to use the information that I get from the study to, of course, educate our community, educate those that we serve, work with community partners and that kind of thing to work on prevention efforts. But this project is also about me as well, and making sure that I'm educating myself and I'm trying to, you know, get information that could better equip me to assist. And so as far as, you know, what I think to learn from the study, honestly, because these are going to be interviews based on individual perceptions, I believe I'm going to get a wide range of different answers. I feel like some people probably do understand that when they engage in risky behaviors or unsafe sex practices, they probably are going to agree that, oh yeah, you know, I'm probably at risk for HIV, STDs and whatnot. And then there may be some that feel that they aren't at risk, that nothing is going to happen to them, nothing happened yet. So, you know, just because I'm going through COVID quarantine, I still don't feel like anything is going to happen. So I do feel like there's going to be a wide range of answers, which is good, because even if it's just one person out of everyone that I interview, even if just one person agrees that I'm not at risk or I don't see a benefit to wearing a condom, that one person is enough to say that, you know, there's more work that we could do. There's more prevention efforts that we can take part of. There's more we can do as far as creating and implementing more health initiatives and health programs. And so hopefully, again, based on the conversations that I have about individuals' perceptions, that will let us know the work still has to continue.
Right. Okay. So being a public health professional, working in HIV/AIDS, and having experience working in the MSM community, but this is going to give you a better overall understanding or a lesson of sexual behaviors within the MSM community. So, was it wanting to learn more about this population to make sure you were more well-rounded professional, or was it other factors that kind of led to push you to do this, or some kind of curiosity, or was it strictly, I want to make sure I'm a well-rounded health professional?
Yeah, it's definitely a combination of both. Like I said, I did want to make sure that I understood more about the populations that we serve, you know, within this community. And then also, if you know, look at the data, right, from the CDC, back in 2019, I believe it was around like 65% of new HIV diagnoses were in that MSM population, male to male sexual contact. And so, you know, I definitely feel like based on that information, there has to be, you know, something that we're continuing to do as far as providing our communities with the information and the knowledge that they need to know as far as how to protect themselves. And so I wanted to, again, find a way that I could learn more information so that I could better assist you all and others that work in the area, agencies and whatnot. But then I also wanted to attack a real life situation, and that is that population is at high risk for developing HIV and STDs as well.
Yeah. And I think one of the things that's interesting for me is being a man that's not in the MSM community, but understanding male socialization and male socialization around sex and sexuality. Mm-hmm. But also working in HIV/AIDS for so long and having the understanding, not a full understanding, but having the understanding that I have of the MSM population, I still say male sexual socialization, in my opinion, doesn't change because of your orientation.
Mm-hmm.
Your orientation doesn't affect the way you are taught about sex, or even not taught about sex because you're a man. Some of the ideas is you just supposed to know.
Mm.
Because just think about it, just across the board. If you tell your child don't bring a baby home, but you don't tell your child how not to not bring a baby home.
Right.
But imagine giving that message to a male who's interested in men, but you don't know he's interested in men. But you just saying don't bring a baby home. You're not saying don't have sex. You're not saying regulate yourself. All thing you just saying, just don't get nobody pregnant. That's the only type of regulation you need. Just don't bring a baby home. So that doesn't mean don't go out and just have sex. That doesn't mean don't discriminate. That doesn't mean any of that. That just means you can do whatever you want to do. Just don't bring a baby home.
Mm-hmm.
But you're taking that mindset, but you're also giving that to a population who pregnancy is not a big concern. It's more disease transmission. So there's still that same socialization, that same mindset with a lack of education and resources about keeping yourself safe and protected from HIV or any other STD. So you're throwing these males out in this world with all young teenagers too, and testosterone flowing, and as you get older and all these things happening, and alcohol and all these things. I mean, you're gonna have this stuff. And so that's what I think your study is important, because we're gonna learn a lot more about the populations, and also the type of study you're doing. Because you know how people are skeptical of studies.
Of course. Of course.
It's like everybody's skeptical of a study, but they don't have any alternative information.
Mm-hmm.
So this will be good for you doing it, but also for those who are going to be a part of the study, who can get a firsthand view of what it is to be a part of the study, what a study is like, that can debunk some of those myths about studies.
Yeah, and I definitely am going to have to see if I can find out. I do know when my actual research presentation day is, so I'm going to have to see how I can get that information transferred so that you all could definitely watch. It is going to be a virtual presentation. I believe they are right now telling us 5 to 7 minutes, but hopefully I can get the information to you all so that you can, basically see what I come up with. Because I do want to make sure that I share that information with you guys so that we can kind of disseminate around. So I'll keep you posted on that.
Okay. And we kind of touched on this earlier, but just the overall hypothesis about sexual behaviors. Going into the pandemic. So I ask like this: before the pandemic, what was your knowledge of MSM sexual behaviors?
So I definitely feel like, based on the data, that the MSM population, we're at highest risk. That I feel like makes a strong argument that there was some high risk behaviors going on. So, whether that was engaging in unsafe sex practices, we do know that there's drug use as well as is another high risk behavior. But, definitely I wanted to focus more on those sexual behaviors with my study, to get just a better understanding of, and I do have, without going into too much detail about the questions per se with the study, but we are going to talk about their perceptions of sexual activities before and during, to kind of get a snapshot of, was there a difference in how they felt before the pandemic versus during the pandemic. But I do feel, like I said, that there's a strong argument that we can make that there was unsafe practices going on, and whether that was because of lack of knowledge, or again, looking at perceptions, if they didn't feel like they were at risk, or maybe they didn't see the severity of it. So if I get HIV, I mean, I can live a long life, right? It's a chronic disease. So
Right.
maybe it's not, to me, it's not as serious as maybe, 30 years ago where people were unfortunately passing away. You know, obviously people now are probably looking at it as, well, if I get it, it's not going to do anything to me. I can just take medicine and I'm fine, which is
Hmm.
true. But then you also have the barriers that we're also looking at as well. So I talk about condom usage. Was the stay-at-home orders, was that affecting access to condoms? So if you are, at home with your partner and you run out of condoms, for example, and you can't go to the county health department because they were closed, or you can't go to the store because the stores were closed, what would you do? Would you either decide not to engage in activity, or would you do it anyway? So we're looking at all of those things. We're looking at barriers that they may have encountered. Again, I talked about frequency, access to sex as well, whether that was limiting outside partners, or if you, again, had, like the example I just gave, someone that you're already living with, did that have an impact? The risk, again, with condom usage or lack of condom usage per se, and then just the perception of, do you even feel that you could potentially get HIV or STD? So we're looking at
Right.
all of those things.
Okay. Yeah. Um, that is interesting because, like I said, I'm very curious about it. Looking at behaviors before the pandemic, and then looking at what we've seen behaviorally during the pandemic. I'm hoping when like stats come out in 2 years from now that it's not an explosion of stuff that has happened, because we've had a lot of people with some rebellious behavior. Um, if you don't wear masks, if you fight not to wear masks, it might be other stuff you fight not to wear.
Exactly. That's a great point.
Right, but also the question you're asking is, if I don't have access to the health department, if I don't have access to a convenience store somewhere I can buy condoms, will I still have sex? I'm not gonna say a lot of people, but we do know a number of people. For them, the answer is yes. You're still going to have sex. Do you know the status of your partner before you have the sex? How often are you getting tested? Are you having conversations about sexual behavior and disease? Those are things I'm interested in asking, because, and those are questions that we do ask when we do our testing and counseling, but we haven't really been able to reach the population the way we want to in 2 years. So it's going to be interesting when we get back out just to see what the numbers really are.
And it's so many different things that I could hit on. I mean, just like you were saying with the questions with the counseling. And so I could have definitely made this huge, because it's so many different areas that I could focus on. But for sake of time, I was trying to limit it to 30 minutes. A lot of people, might not want to talk for 30 minutes.
Right.
I probably wouldn't want to talk for 30 minutes. So, I do understand that I was trying to be respectful and mindful of people's time. And so with that being said, I did have to kind of try to narrow it down as much as I could. But
right.
This really could have been pretty broad, and we could have looked at a lot of different topics. And hopefully once I start getting into the interviews, I can kind of develop some themes. So we're looking at, demographics is another thing that we're going to be asking as well. So hopefully, we'll see if there's any similarities within certain age groups, maybe. Yeah. So being in Tallahassee, we have a huge college base. So is there any similarities amongst men who are between 18 and 22, for example? So we're definitely going to be looking at all of those to see, is there anything that's linking any particular group, whether it's age, or education level, for example. So hopefully we can get a lot of good data from our interviews.
I am curious to see two groups as far as age, the 15 to 25 and the 50 plus, see what their thoughts on their habits and behaviors are during the pandemic. So with that being said, with the information, like after you collect the information and you go through it, you break it down, you understand it, what do you plan on doing with that information in the future?
So, it's all about education and how we can continue to promote awareness of safe sex practices. And so the information that we hope to collect from the study will, of course, be used to further aid in prevention efforts and initiatives. But ultimately, with everything being said, right, the ultimate goal is obviously we want to attack those diagnosis rates. So we want to reduce HIV and we want to reduce the ST diagnosis. But it all starts with education, right? We got to first provide the education, know what we're dealing with. And I think, you know, you mentioned earlier, understanding people's thoughts and perceptions. I think that's going to be key, because they may have the education, they just may not feel it applies to them. So definitely want to try to get as much as we can to try to assist with prevention. So, but yeah, I'm excited about this study. Like, I could not have asked for a better topic, a more timely topic as well, given that we're still kind of in pandemic season. Now they're calling it an endemic, so it's something we'll just have to get used to.
We'll see.
But I definitely feel like this information, I'm hoping, you know, if I could publish, that would be even awesome. But I'm so excited about this opportunity and looking forward to share what I find out with you all very soon.
Yeah, that's gonna be good. That's gonna be good. So, not full detail, but can you explain the interview process and what participants will expect when they're taking the Bill survey?
So the interviews are going to be on Zoom. So you don't have to worry about trying to link up in person. Everything is virtual, which is perfect. As I mentioned, it should last about 30 minutes or so, no more than 30 minutes. It could be less than that. There are some inclusion criteria. So one being you have to be in the MSM population, a male who has sex with men. The age is between 18 to 55. You have to reside in the Big Bend area. And if you have English as your native language, so you read, understand, and can speak the English language as well. One thing about the interview, even though it is going to be virtual, you do have to consent to being audio and video recorded as part of the consent process. But for privacy and confidentiality purposes, again, people may not necessarily want their name to be known. They may not want to be seen. And all of that is perfectly fine. That does not negate you from participating. And so what we can do, and this can be set up before the actual interview, is we can find a way to change your alias. So when you go on Zoom, they usually ask you to type your name or whatever. So you can put literally whatever you want, letter A, B, C, D, interview person, whoever. You don't have to use your name. And then as far as the camera part, you can have your camera off as well. And so another thing, because the whole thing is about being comfortable, right? So if someone is uncomfortable with having the interview with me as the person asking the questions, that's also okay. So we were able to get approval to have someone speak with a trusted friend, advocate, professional. That person can actually conduct the interview on my behalf. It's as simple as me just giving the questions to that person and basically giving them instructions on what to do. But if that person is going to be more comfortable speaking with someone else, I would rather do that because I want full transparency, want it to be a candid, honest conversation. And so whatever we need to do to kind of get someone to let their guard down and honestly speak from the heart without feeling any type of pressure, that's the ultimate goal of what we want to happen. I do have to disclose that there's minimal risk associated with the study. There's potential risk of psychological discomfort just talking about, the subject. It could be sensitive, for example. There's also a risk of maybe re-experiencing or reliving previous sexual experiences. And so at any time during the interview, if someone feels uncomfortable answering a question, you do not have to answer the question. If someone feels that they no longer wish to participate in the interview, let's say we get started and it just becomes, overwhelming, they, choose to no longer continue the interview, that's perfectly fine as well. You can discontinue or stop the interview at any time. Anytime. And so I'm looking for about 20 people to sign up for an interview. And so I guess I can leave my email, or should I state
But
my email address? Or?
your email will be in the description. It's in the description, but you can say it now.
Okay, so if anyone is either interested in participating in the study themselves, or if you know someone that would be a good candidate for the study, please email me at Danyelle, which is spelled DANYELLE, the number 1, dot Williams, WILLIAMS, at famu.edu. And that way we can set up a time to schedule the interview. Or Joe, I'm gonna throw you out there as another person that they can reach out to if interested. And so if you reach out to Joe, you feel more comfortable speaking with him and setting something up, of course, he can get in contact with me as well. My goal, well, actually my deadline, is to have all of the interviews finalized by the end of this month, which is basically next Thursday or so. So I have about less than 2 weeks to try to get all of the interviews completed. So that way in April, that'll be my time to, conduct the analysis of the interviews. But any help would be greatly appreciated.
So So I've posted the flyer on our Neighborhood Medical Center Facebook page with the email. The flyer is on our Neighborhood Medical Center Instagram page with the email. And like I said, the email also be in the description of this video. You can contact me, jward at neighborhoodmedicalcenter.org to get more information. But if you let's help Dr. Williams get this study done. So if you're out there and you want to participate, go ahead and participate. Contact us. It'll be all anonymous. Nobody gonna know you did it. But this will be very, very, very important so we can make sure that we get the information out. And here is the flyer. One of these sides is popping up. One of these hands. You can see the flyer. Here is the flyer. So make sure you check out this. This is what the flyer looks like. One of these hands. I don't know. One of these hands. The flyer is in one of these hands. So this is what the flyer looked like. And this is the email. So make sure you check it out. And once again, it's going to be in the description, and help Dr. Williams get the study done. All right. Yeah, so that's how you contact her. That's how everything happens. And just another way for us to learn more about the sexual activities that's going on within our community, especially within the higher risk populations of our community, so we can make sure that we are helping people keep things safe. So with that being said, Dr. Danyelle Williams, you are the greatest, as you already know. We love you around these parts. And anything we can always do to help you, we definitely will.
Thank you. Like I said, this degree is for all y'all.
Right. This all us. Community degree. There we go.
That's right.
Hey man, that's what we do. We love it. We love it. We love it. Mind Your Body and Soul, your healthiest podcast. Remember, we're an educational podcast that focuses on all things health related to help our listeners learn more about the various health topics and information they may not have access to. We seek to inform, empower, uplift, and mobilize our listeners to become the healthiest versions of themselves. www.nmcpodcast.com, www.neighborhoodmedicalcenter.org. Our podcast platforms are Anchor, Breaker, Radio Public, Pocket Cast, Spotify, Google Podcasts, and of course, we're right here on this YouTube. Like, subscribe, comment, share, all of that. Be a part of this thing to make sure people have this health information. I am Joseph Ward. She's Dr. Danyelle Williams. And we are out of here. See y'all beautiful people next time.